Two sea ambulances are among the latest possible additions to the Trinidad and Tobago's healthcare system, thanks to a new agreement signed with the government of India. This was confirmed by Minister of Health Dr. Lackram Bodoe, who said the donation is part of a broader partnership that will improve access to care, medication, and medical equipment.
These will be deployed in our remote areas. For example, if you have someone who is sick, in Icacos and needs a facility maybe in San Fernando, that is a recognized form of transport. These are medical ambulances. And of course, there's a possibility on the East Coast as well of utilizing these maybe from Mayaro to Sandy Grande Hospital. And we are also looking at the possibility of whether these ambulances can actually service the route between Tobago and Trinidad.
Meanwhile, Dr. Bodoe said with the signing of an MOU which allows for the recognition of Indian pharmacopoeia, it would open the door to more affordable medication.
That is going to open up the market in terms of the drugs that will become available to our citizens, and we anticipate that it will be at a lower cost to our citizens. Of almost immediate benefit as well is the donation of 20 dialysis machines. Of course, renal dialysis is a big demand in the health sector, and these 20 dialysis machines will add to the in-house capacity to assist those of our citizens who require renal dialysis.
He said Cabinet is reviewing the CDAP program with plans to expand access to Indian pharmaceuticals.
The Cabinet has just received a report on a review of the CDAP program. Of course, you remember this was promised in our campaign in the manifesto, and that report is before Cabinet. I believe that very soon the findings and recommendations of that report will be made public. And from my preliminary review of that report, it would appear that there will be a review of certain drugs. And one of the recommendations that hopefully will be approved by the Cabinet would be to engage specifically with the government of India in terms of certain drugs and more so other medical supplies.
And Minister Bodoe also pointed to recent amendments to the Children's Life Fund, which would allow foreign specialists to work in Trinidad and Tobago.
It might be an opportune time to share with the population that amendments to the Children's Life Fund that was recently passed in the Parliament would have allowed for foreign specialists to come to use our facilities. And India, of course, as you know, would be one source. In fact, currently, we are utilizing the Children's Life Fund to send our children to hospitals in India. And we are hoping that now we can have those same specialists come to our shores. And of course, that will be convenience and reduce cost to our citizens. So that is an immediate benefit that we are hoping and looking at.
The health minister said he anticipates major benefits to citizens following the signing of the MOU with the Indian government on Friday. Sonolala, TTT News.